A very good day to my well-wishers and my colleagues as I record for you the AcuKnowledge video for today. Today we are going to talk about the most powerful points which we use in acupuncture for treatment of pain in the foot. Now this pain in the foot can be on the plantar side of the foot, along the arch of the foot, and the most common cause is either a calcaneal spur or a plantar fasciitis. But I have found in my clinical practice, if I needle the affected areas, then so many times the pain actually starts increasing. So what I have developed with my experience of so many years is a protocol in which I use points on the opposite side and do not needle the affected side. And for treatment of this condition, which I have talked about just now, I would mostly use the points on the hand, because the hand is a reflection of the foot. So suppose a patient has a pain in the right plantar fasciitis or a right calcaneal spur pain, then I would be using points on the right hand along the lung meridian, and because this pain on the foot is along the spleen meridian, so we all know by our experience that the lung and spleen are the tie-in meridians. So you can use points on the lung meridian to treat the spleen meridian, and so the reverse is also true. So these points are located along the thumb, and we look for reactive points. The center point is the lung 10, and just 0.25 chun anterior and posterior to that are the other 2 points. And for the pain at the base of the great toe, if the patient has got pain in the great toe, then we have a very good combination of the tongue points, which are the 5 points here. These are known as the Wushu points. They are right at the base of the thumb. I will be definitely demonstrating these points to you also, so that you can know exactly. And these are very good points for great toe pain, particularly for patients with gouty arthritis. Now, in addition to these points which I have showed to you, we will also can use the points along the wrist crease, which are the tender points along the wrist crease, which is the Muguan, the Guguan, and the center point is known as the Zongguan. Now this Zongguan points is just anterior to the pericardium 7, right? Another classical protocol which I also used, if none of these protocols have got me the results, but remember, when you put the needles on the opposite side, make the patient do active movement of dorsiflexion, plantar flexion, external rotation, internal rotation, and clockwise and anti-clockwise rotation of the foot with the needles in place. This will, you can see the immediate improvement also, and if the patient has had pain in any of these movements, it will immediately start improving, which brings a lot of confidence to the patient. Another protocol which I use for pain of plantar fasciitis is a TCM protocol, which we have been using for a long time. But in this case also, we have the points which I am going to demonstrate to you also. These are extra points. They are not on the normally the points where we use. First point is kidney 3, but again remember, I am not needling on the affected side. I am needling on the healthier side or the unaffected side. The points used are kidney 3, 2 chun below kidney 3, and extra point 2 chun below medial malleolus, and again on the opposite side with active movements of the affected foot, and you can see almost miraculous results in the pain relief immediately. Depending upon the chronicity of disease, if the patient has had this problem for a long time, it may take a few sessions. Normally we start with thrice a week sessions. As the patient gets better, we reduce it to twice a week and then once a week. And if a patient comes to you with an acute sprain and acute ankle pain or acute pain in the foot, then you remember that one of the best treatments to do is to bleed and cup at UB40 and UB57. I will be now demonstrating to you the exact location of the points. So suppose this patient had a pain in the left foot along the because of a calcaneal spur or a plantar fasciitis. The points which I will be using would be we all know lung 10 is a point here. So we take lung 10 as a midpoint, but remember we can needle all the 3 points, lung 10 and 0.25 anterior, 0.25 posterior to this. But remember, you don't have to needle all the 3 points. You can choose the most reactive points amongst them, and you will always get reactive points, and always needle on the opposite side, so that the affected side, the movements of the foot can be done to see the change in the pain. And then we have a very special, these are known as 2 Shui points, again Tung points. And then we have a group of 5 points located right at the base of the thumb. These are known as the Wushu points, or the 5 tigers. And again, look for the reactive points on this line, and needle only the reactive points. Most of the time the acute pain can be relieved from these points only. However, if the patient has got chronic pain issues of plantar fasciitis or calcaneal spur, we can use the points again, Mu Guan and Gu Guan, which are located on the wrist crease. Look for tender points next to the bone, because we are treating a bone pain, so bone treats bone. So Mu Guan and Gu Guan, and the midpoint of this is P7. Just go a little bit anterior to P7. This is known as Zong Guan. So these 3 points, again look for the tenderness and only needle those points which are tender. You can use half-inch needles at all these points. And remember to ask the patient to do active movements after you have needled, and then retain the needle for half an hour, as we always do. Now I will show you the protocol for the foot, which I was telling you before also. And this is a purely TCM protocol, but the points are slightly different to the TCM points. There are some extra points also. So if the patient has not got relief with what I did before, then you can try this protocol of using kidney 3, then 2 chun below kidney 3, and the third point is 2 chun below medial malleolus. So these 3 acupuncture points, needle them on the unaffected side and ask the patient to move the affected side. Never needle the affected side. The results are almost marvelous, and your patient can see the results immediately. Thank you very much for listening, and I'm sure these will help you in treatment of such recalcitrant problems of the foot pain, and you will also enjoy treating your patients and also seeing the results almost immediately. Happy healing. Thank you.